Let's speak to Niall Dickson about this. He's Chief Executive of the NHS Confederation. Good morning to you, Neil.
Good morning.
Well, you also represent hospital trusts around the country. Matt Hancock, it felt like he was rather pressured into this test. It wasn't a question that was put to him in a press conference, but there was a time when the government certainly, quite a few weeks ago, was just looking very rudderless. Boris Johnson off sick, and it looked like they sort of lost the grip. And Matt Hancock did this incredibly reassuring, I felt, press conference at Number 10, and he promised that they would ramp up testing. A lot of concern that we drop the testing targets far too, at all, which was a bad move. He promised 100,000 by the end of April. Now, on Tuesday, it was around the 50,000 mark that were carried out. Again, not capacity, actually carried out. 81,611 carried out on Wednesday. That was up 30,000. We won't get the figures for yesterday, for the end of April, hitting that target until later today. Yesterday, the government was sort of pooing the idea that they'd hit it. Now, apparently, Matt Hancock's pretty confident he will hit that 100,000 target. Question I've put to so many medics and experts over the last few weeks: does it matter whether he gets 99,000 or 101,000 today?
It may matter politically and in terms of what's in the media, as it were, but missing the 100,000 target is pretty meaningless, other than underlining the fact that we've still not got enough tests to test all the staff and patients who would benefit from it. And it also shows, I guess, that access to testing continues to be a real challenge. Now, by setting the target, he may have, sent the right signal to officials and others that this is, high priority and so forth. So I don't know the actual effect of setting that target. But one of the things, of course, it does do is challenge the confidence. So if he doesn't hit it, I suppose this is the only thing that matters, is that there is a real confidence issue, especially among frontline staff. We've talked on this programme many times about PPE, the protective equipment, and about testing. And the question is, if you're in that frontline position and you think they make these promises, they say this stuff is going to be delivered or those tests are going to be available, and they're not, then you undermine confidence in the whole process. And I think there is still quite a lot of building of confidence that's needed. The other thing to say is that, and I think there is a slight communications issue. I'd certainly like them to be absolutely clearer about why we need testing at different phases. And it does change. So we started off with this, contact and trace process. We then moved into staff and patients who are most seriously ill need to have it. Not enough done, I think, at that phase around care homes and so forth. We're about to move into a different phase, and I think that's probably why he set this high target, because we now, we're ramping up the NHS again, so that will require more staff testing, because we were almost getting there. A lot of chief execs I spoke to, certainly in the hospital sector, saying, no, okay, testing-wise, we are getting the testing for our staff, and we have managed to speed up getting the results and so forth. So that's beginning to happen. But now we're moving to a new phase where the NHS is doing a lot more. And really, we should be going to mass community testing as we lift the lockdown, so that everybody who has any kind of symptoms is absolutely tested, and then you do this tracing after you've done that. You contact, then trace those people, and that will be vital in keeping the level of infection within the community down.
Yeah, I mean, again, we know it's very different across different communities, don't we? Whenever we see those graphs at the Number 10 press conferences in the evenings, they show very different lines for different parts of the country. For instance, of course, infection rate and death rate going down in London, which has been by far the peak. Obviously, it's a major conurbation, 9-10 million people. And yet there are parts of the country, say, for instance, the southwest, which have very, very low levels indeed. When the government says they are carrying out testing, and they have been doing some sort of random testing across, I think, 30,000 people across the country to see the spread of the disease and try to get an idea of how many people may have been infected but don't actually have any symptoms, the asymptomatic people who may well, we hope, have immunity. Certainly South Koreans seem to be suggesting that is what they will expect, certainly for a few months at least, maybe not for a full year. But when it is so different in different parts of the country, is that any use? I mean, it may well be, that someone living in Wiltshire, there are very, very levels of infection, but it may well be very high levels of infection in, say, Birmingham or Manchester or a particular borough in London.
Yes, but I suspect as you start to lift lockdown, if you've got overall you've managed to get that, the R figure they keep on talking about, if they've got that well down, then that absolutely means you should be then starting to not just say, oh, well, everybody who has a symptom should lock themselves away. You should be getting out there and testing those people so they're symptomatic. I think with the asymptomatic, it is a really interesting issue, because you'll remember at the start, people said, well, there isn't any point in testing people who are asymptomatic, because they may well give you a false negative. In other words, they've got the virus, but they haven't got enough of it, or it's not demonstrating, the load isn't enough to show you at that point that they've got it. That view seems to have changed. So again, of course, the science does change, and our understanding of it. So they are saying now that testing asymptomatic people is worth it. It won't give you an absolute assurance, but it does begin to help you to understand how far the virus is spread in the absence of an antibody test. Do you remember we were, that was going to be the great thing that was going to come, and of course that hasn't appeared yet either. So we're going to have to rely, I think, on the antigen test, unless something emerges fairly quickly. We're going to have to rely on the antigen test, and therefore use it both asymptomatically and symptomatically going forward.
And in terms of the ongoing battles over PPE, personal protective equipment, different stories that will make their way onto the front pages and make their way off. Is it your view at the NHS Confederation that you're now getting the PPE you need? We know that a lot of it's very just in time, but and it's not like people know they've got cupboards full of the stuff and they can relax. But is it now the case that is reaching the front line, reaching the people that need it to keep them safe?
So the people that we've been talking to, chief execs up and down England, generally, certainly in the hospital sector, a lot more confidence. I think there's still some anxiety in community services and among GPs. There's also still concern in care homes, and of course the government's now announced a big ramping up there. There's quite a lot of mutual aid going on, so certainly in the community stuff, it's about local bodies coming together, receiving some of the big deliveries from the centre, and then deciding themselves locally how they're going to distribute this, which I think has improved, because that they kind of tend to understand what's going on. But so I wouldn't say that across the whole piece it's all great, but I would say it's certainly a lot better than it was. And I think there are still ongoing problems within the care homes. And in terms of the virus, I think the care homes, you talked about variation around the country. I think that what's happened in care homes, of course, has been an absolute tragedy. And I think that there's still far too much virus within care homes across the country. And that is the bit that we've really got to get down and concentrate on and make sure we protect, as far as we're able, those very vulnerable residents and the staff, frankly, who are working within them.
Absolutely. Niall Dickson, always a pleasure to speak to you, Chief Executive of the NHS Confederation. Thank you very much.